Hi guys, this is Harmony RN from tRNsform Nursing. I'm glad that you're tuning in. If you haven't done it already, make sure to hit that subscribe button in the corner. And thank you for watching this channel. I hope you enjoy the video. Make sure to comment down below anything that you have to say. And definitely comment what a nurse means to you. It would mean a lot to me. What is a nurse? By Harmony RN. The dictionary defines a nurse as a person who cares for the sick or infirm. But the reality is so much more. A nurse is a warm embrace, a listening ear, an interpreter when you don't understand. A nurse is a relationship built on trust. A nurse monitors and assesses, carefully watching and observing to make the necessary interventions. A nurse transforms a sterile, foreign space into a warm, safe place. A nurse is an advocate for those unable to have a voice of their own. A nurse does so much more than charting and medicating. A nurse is empathetic and relating. A nurse holds your hand when there are no words to be said. A nurse graciously helps you in and out of bed. A nurse cleans you when you can no longer clean yourself. A nurse is there for you when you ring your bell. A nurse can look 1,000 different ways, but on the inside, their hearts remain the same. A nurse can come in all shapes and size, but they still look with compassionate eyes. A nurse heals with words and touch when anything more would be too much. A nurse becomes family, caring for you as if you were their own. A nurse cares for newborns to the fully grown. A nurse has compassion and grace. A nurse is a familiar face. A nurse is a stranger you feel like you know. A nurse is wishing you the best and saying they don't want to see you back here after you go. A nurse is someone who listens to the story of your heart. A nurse is the glue holding you together as you fall apart. A nurse is a human touch that this new age cannot replace. A nurse is listening to every patient's case. A nurse creates a care plan tailored to you. A nurse keeps their composure during a code blue. A nurse resuscitates you when you didn't have a pulse. A nurse is there to lift you up when you fall. A nurse is strong when you are weak. A nurse is your courage when you are afraid. A nurse will steady you when you stumble. A nurse will heal you when you're hurt. A nurse will mend you when you are broken. A nurse will lead you when you are blind. A nurse will feed you when you are hungry. A nurse is with you when you face trials. A nurse comforts you when you face loss. A nurse celebrates with you when you are joyful. A nurse is goodness and kindness and trustworthiness. A nurse is love that protects, trusts, hopes, and perseveres with you. I am a nurse. I wrote this poem after receiving the question, "What is it that you do again?" so many times. As a nurse, people ask me what I do all the time, and I feel like there's no easy or simple answer. Yes, I pass meds. Yes, I clean patients. Yes, I chart. But that is not the sum all of what I do. I'm there to be the family for the patient who doesn't have family. I'm there to be with them when they receive bad news and hold their hand and just be there when words are not something that can be said. I'm there to celebrate them with them when they have, new life entering this world. As a nurse, I don't think that you can describe what we do in a few words, because I feel like nursing is a lifestyle. You're a caregiver at your baseline. You're someone who wants to give, that stranger a hug when they're having a bad day. You're someone who's very good at empathy. You're very good at relating to people. And when they're having a very hard time, you can understand that and have compassion for them. I remember once hearing that there are no angry patients. There are sick and there are hurting patients. And that tends to be true more often than not. Every time that I've had a patient who has been upset with, their care or just angry, often it's because they're scared. There's a lot going on that is extremely hard for them. And, that's one thing. Right now, nurses are something that I don't think the world will ever be able to be without. In this new technological era, there's all of these new technologies coming out, but nurses are that human touch. I can't imagine anybody's ever going to want to receive their meds from a robot, because there's just something so human about going into the rooms and being able to talk to these people, seeing how their day is, assessing them, and watching them, especially over a 12-hour period. Oftentimes after a week, I know these people as well as some of their families because I've seen them for 36 hours straight. And you really get to know your patients, and you really do become kind of like extended family. When they come back, you're genuinely concerned and you want to know why they've come back, and you should, and when they're leaving, you're always like, okay, well, I don't want to see you here again, I'll catch you at the grocery store, but I just don't want to see you back here. Get better, be strong, go to that rehab, learn how to walk again, make sure you're eating good. As a nurse, I guess you just want to be there for your patients. So that's why I decided to be a nurse, because I really love what I do. And I think that if you love taking care of people, that nursing is truly something you should look into.